about impact of social media on health policies by Miss Amal Ibrahim. Mrs. Amal Ibrahim, welcome.
How are you, Dr. Sharifat? It's our pleasure to have you.
I'm fine, thank you. I think I'm meeting you face to face for the first time.
For the first
Let me quickly introduce you before you introduce yourself. This is Ms. Amal Ibrahim. She has completed a master's degree in health management and policies from Al Qudus University in Palestine in 2018. She is currently working as Middle East coordinator for UCG Conferences, London. Prior to this, she was a medical referral coordinator in Al-Najjar National University Hospital. She has previously worked at the World Bank assisting administrative and management support to all external experts. I would like to welcome Ms. Amal Ibrahim to start a speech. Thank you very much for joining us.
You are more than welcome, Ms. Sharifat. Hello, everyone. Really, I appreciate all of you for joining us for the second day of the conference. So as the time is running, so let's start fastly. I would like to ask first, can you see my slides? So first of all, I'm presenting my topic today about impacts of social media and health policies. First, I would like to ask all of you, what do you mean by social media? Please, can you answer in the chat box? Well, social media is the term generally refers to internet-based tools that let individuals communicate together and communicate, share information, ideas, personal messages, images to collaborate with other users. As we all know, social media are interactive digitally media technologies that facilitate the creation or sharing, exchange of information, ideas, careers, interests, and other forms of expression via virtual communities and networks. It's also a collective term for websites and applications which focus on communication, community-based input, interaction, content, sharing, and collaboration, social networking, social bookmarking, social iteration, among different types of social media. Social networks decide as web-based service that allow individuals to construct a public or semi-public profile within a bounded system, articulate a list of other users with whom they share a connection, view and turn over their list of connection and those made by others within the system. Examples for social media is blogs, wikis, social bookmarking, status update services, virtual world content, media sharing sites. I would like to ask all of you, which of the following social media networks do you use daily and why? Facebook, Twitter, Instagram, LinkedIn, YouTube, or Snapchat? Please write your answer in the chat box. So the next question is, what are the reasons for using social media networks professionally? As for networking, health promotion, employment and research opportunities, education and professional development, or for self-promotion. Well, let me check the comments, please. Mr. Carl is writing he's used Facebook for friends, LinkedIn, or for education, colleagues, friends. Miss Lena is answering Facebook, Snapchat, YouTube, and let me check with Ms. Susan, Insta, LinkedIn, and YouTube. Perfect. Using media to affect health policies making. In the area of policy making, media can contribute to setting the agenda for press, public, and policymakers through highlighting what issues are used mostly at a particular time. Media can also influence how the public and policymakers view or think about certain issues through selecting some aspects of perceived reality and making them more silent in a communicating text. Shaping public opinion, which in turn exerts pressure on policymakers to respond. Next, please. Media advocacy is known as a popular strategy in public health that can assist in increasing public awareness and mobilizing decision makers for policy change. Social media increase user interaction, provide peer support, and extend access to health interventions. Social media also bring a new dimension to healthcare as they provide the public, patients, and health professionals with a platform to exchange on different health matters. Next, please. Social media positive impacts on health quality of healthcare. The first point is create authenticity. As we all know, the days when patients listen to doctors without asking questions, healthcare consumers are smart and want to have relationships with those who care for them. Allowing one or two technique-savvy employees to share pictures of office or facility events helps to bring a level of humanity to any practice. Offering a behind-the-scenes look will increase consumer engagement and improve overall client satisfaction. When patients enter the walls of your office and can recognize the receptionist or nurse, it helps them to engage. They relax and might even share the health history a bit more openly when they feel a connection with those in office. The number, increasing access across the generation. Point three is keeping an eye on competitors. Many administrators keep a close eye on their largest competitors through social media. They can evaluate community involvement, pain points, and services lines without ever leaving their office. Providers and hospitals can also read feedback on new technologies and procedures competitors are using. This might help them decide if they want to pursue these new approaches to care before making this investment. Everyone knows that unhappy customers make their feelings known. Administrators can comment in posts about customer service techniques. Not only do you gain insight into poor patient experience, but you can also get ideas on how to develop your own response plan. Take note of what platforms competitors use and where they perform well. This removes some of the guesswork out of where to begin if you are just ramping up your social media strategy. Training in new staff, real-time updates. Social media allows healthcare professionals to communicate situations and possible emergencies quickly. From census notification to crisis alerts, updates can provide life-saving information. An excellent example of getting real-time information about out to the masses can be seen on the World Health Organization Twitter feed. They provide information on anything from sugar consumption to the latest world or local crisis. During disasters, the World Health Organization has used social media to educate individuals on safety measures and where to locate critical resources like food and water. The final point is gathering feedback. Next, please. Social media advantages are quick dissemination of medical information, healthcare access across vast distance, mechanisms for cost control, collaborative nature of social media. Disadvantage is privacy concerns, limits on holistic patient information, and social stigma. Next, please. Now let's talk about the benefits of social media in healthcare. The first point is raise awareness. Social media is a key way to raise public awareness about new, emerging, and annual health concerns. Healthcare systems must provide trusted information in immunization, flu, virus therapy. Sometimes raising awareness is as simple as reminding followers about common senses, health practitioners, or addressing common health living concerns. Point two is combat misinformation. As we see here in this slide, social media, by their very nature, helps spread information quickly to diverse groups of people. That's great when the information is fast-paced, helpful, and clear. Unfortunately, there is also a lot of health misinformation on social networks. Sometimes the misinformation comes in the form of in-nature statements. These are relatively easily debunked. You can simply cite published research or the latest information from a credible health source like CDC or WHO. But sometimes the creators and disseminators of misinformation use a reputable institution's name to give their statements credibility. In this case, it's important for the institution name as a reference to clarify that they are not the source. 23 is crisis communication. More people now get their news from social media than from newspapers. That makes social a key place to share breaking information. Next slide, please. Okay. Answer common questions. Health authorities and other organizations working in the healthcare field are a valuable source of information about all kinds of health concerns. Social tools offer creative way for healthcare professionals to address common questions. For example, the government of India developed a Facebook Messenger chatbot. It can answer questions, direct citizens to the right resource, and counter misinformation. final point is public health monitoring. People post about everything online, including their health. Hashtags like flu can reveal when diseases are popping up in new locations. Public health organizations a sense of the severity of symptoms. Social media offers advantages over traditional data sources, including real-time data availability, ease of access, and reduced costs. Social media allows us to ask and answer questions whenever through possible. Here, we can see Health Map is a project created by a team at Boston Children's Hospital. It tracks public health threats through data points, including crowdsourcing. Next slide, please. Actually, now let's watch this video about use social media for impacts on public health policy. Please click on the video. Okay, I left the videos for at the end of my presentation. Next, please. Next slide. Okay, and this one, how was social media changed public health practice? I will share it at the end of my slide. This video by the Michael and Susan Bell Center for Health Living and at the University of Texas Health Sciences Center at Houston. Okay, these questions I want from all of you in the chat box answers for me or for yes or no. What do you think? The first statement is, I believe that the health news I have encountered in social media and the interest is relevant. So it's yes or no. Okay, let's read Mr. Carl comments. Not always. Okay, another answer. Okay, the next statement is, the news I have encountered in social media and the internet reduced my trust across the health system. If it's yes or no. Okay, Dr. Maria said, yes, I have. Mr. Carr says no for the second time. Okay, third statement. I find the statements of professionals in social platforms informative and correct in issues such as vaccines and diet by people who are not healthy. Okay, Miss Susan says not always. UCG support says no. Mr. Carl, yes, but not always. So we have to move to the next slide, please. I think that the health news that I counter increases the violence against health workers. Okay, Ms. Susan says no. Either Ms. Carr and Dr. Maria. I think that the health news that I can encounter provides a reduction of violence against health workers by providing deterrence. We have two answers as no by Miss Susan and Dr. Maria. Okay, and the last statement is the health news I have encountered allows me to empathize with health workers and create a positive prejudice against them. Okay, first answer is yes. Perfect. Next slide, please. Can we go? Yes, okay, perfect. Social media tips for healthcare organizations. Educate and share valuable content. Many people turn to social media for information in times of crisis, but to engage with the public for the long term, you need to regularly provide valuable content that educates and informs. For example, the Mayo Clinic creates social videos series to cover popular health and wellness topics. The Mayo Clinic minutes are short, informative, and engaging. The videos regularly rack up more than 10,000 views. The information needs to be credible, of course, and true, but you can get creative and entertaining if that makes sense for your brand. Listen for relevant conversations. Social listening allows you to track social media conversations relevant to your field. Those conversations can help you understand how people feel about your organization, and your products and services. You can also learn how they feel about the competition. Remain complaint. One of the big challenges of social media in healthcare is that healthcare social media accounts are subject to strict rules and regulations. Don't forget to keep an eye on the comments users leave in your social media posts and profile too. These can also create compliance concerns. It's always good practice to respond and engage with social comments. After all, no one likes talking into a void. Your followers will be more likely to engage with your content if they get a response from someone in your team. Stay secure. It's important to put security guidelines in place for your healthcare social media channels. You need to be able to revoke access for anyone who leaves the organization. Social safeguards can help screen your social posts against your social media policies. This prevents non-complaint posts from going live. The simple truth is that patients and the public use social media to find healthcare resources. They use it to look for information, find support, and make healthcare decisions. Challenges of social media and healthcare sectors. The ability to respond publicly and in timely manner to spread of misinformation and health-related rumors during public health events. As, as the development of applications for sharing personal health information and ask people to share health data about themselves continued, keeping up with the requirements of personal and patient privacy will be vital in order to protect social media users. Next slide, please. The verification of this shared health information, especially as it relates to fast-moving epidemics or heightening seasonal health concern, is crucial to keeping the public accuracy informed. Next, please. Can social media really shape health policy? Government agencies, nonprofit organizations, civil society, and international organizations have all established presence in major social media sites. The most important reasons cited for hopping into the social media are communicate with stakeholders, engage with customers or citizens, listen to feedback on the ground, respond to issues faster. A perfect example for this point is WHO in 2015 on the World Summit on the Information Society Forum held in Geneva, a discussion on emerging global opportunities for using social media to connect for health turned the spotlight in the communication strategy of the World Organization to engage with stakeholders in global health. Next, please. Social media as their policy strategy. As we all know, WHO as a convening power believed that it had the legitimacy and power to make people follow the WHO's advice on matters involving public health issues and to convince policymakers adopt the recommendations given by the agency. So they believe they have the power so that can they lead to change. Next, please. WHO has mentioned the 5 reasons for its social media presence include providing information like health data, health trends, and policy recommendations, communicating public health risks, articulating policy and practice for better health, building trust and bringing about change, reach more people in a more timely vision so they can tweet WHO statistics before they are published on the web. Next, please. Social media statistics in Palestine. As we see here in the figure, 52% of the Palestinian people is connected to the internet. 55% is the proportion of the smartphone users to enter social networks, and 70% are Jawad and Paltel acquire more than 70% of the market size of cellular and ADSL internet. Next, please. Here is some examples from Palestine Ministry of Health Facebook about how they deal with social media information and social media news. You can watch it at next, please. At any time, I can share it with you. And this is the Palestinian Ministry of Health is answering and announcing the correct information about the wrong news that shared in the last slide. Next, please. This is the also Palestinian Ministry of Health official Facebook account. They told us about how the Minister of Health, the last Minister of Health, Dr. Jawad Awad, and he is answering an important issue in Palestine. Next, please. This is the same announcement. Okay, I would like at the end of my presentation to share with you the National Institute of Mental Health advises how to cope with COVID-19. First, take breaks from the news, take care of your body, make time to unwind, connect with others, set goals and priorities, focus on the facts. Next. These are our references for my topic for today. I have to thank you all of your joining us and participation. If you have any question, you can contact me on my email, Twitter, LinkedIn, or my mobile. If I have still time, I want to share with you the videos.
Okay, thank you very much, Amal. Suzanne Rayburn-Burgess here. I was the chair from yesterday. I have just taken over quickly and kindly as we have some technical issues. So
Okay.
basically,
I have two videos. Each of them is 1 minute. So can I share it?
of course you can. Go on.
Okay.
There is no sound, Amal.
Okay, let me check. Okay, I will check with the other one.
There's also no sound, Amal, I'm afraid.
Okay, I'm afraid too. Um, so I can share it with all of you at the end of the day, no problem. Hope you are joining my session.
Okay, thank you very much, Amal,
You
for
are
your very interesting topic, especially as we're sharing our situation now on social media. So it's not so easy, especially then to work it all, isn't it, in the end of the day?
actually, I would like to thank you all, and I will want to welcome Mr. Carr.
Wonderful. Yes, so I think we're at the end of this morning session. We will now